unfortunately it's not the best arrangement. We don't have a couch, proper patient couch and fully exposed patient, but we'll continue with the hip and groin examination. As for any examination, the most important thing is when the patient is coming into your consultation room, you check the gait, how the patient is walking in, are they limping on one side or on the other side. That will give you a bit of a clue. Then take a thorough history as to exactly where the site of the pain is, how long they had that for, did they had any injury, it started on its own. Most important thing is taking some history about they've got any previous back problems, knee problem, because hip or groin pain can easily be mistaken for referred pain from the back or the knee. Right. First of all is inspection. So after asking the patient where it's painful, whether it's the lateral aspect in the groin or the buttock, then we'll inspect. So when you're inspecting the hip, you inspect for the symmetry. So whether both the hips, with the pelvic bones, anterior superior iliac spines, if they're fully exposed, is in alignment. Similarly, you check for any muscle wasting. Muscle wasting, is there any muscle wasting, or are there any bruising, obvious bruising? Looking for the two patellas, whether they are aligned in the same position. Checking for the alignment of the leg and any asymmetry in the length. Obviously, when you're taking the history, you need to ask for any previous injuries, any previous operations, hip, knee replacement, some of the kind of things you need to ask about those as well. So after inspection, you do the palpation. Your palpation will start with the anterior aspect. So anteriorly, you will start with palpating at the anterior superior iliac spine, then the inferior iliac spine, then the pubic rami in the middle, and obviously in the center the symphysis pubis, pressing on there as well to check for. While you're doing that, you would look for any swellings in the groin area. If there are any hernias, you might ask for them to do a cuff reflex for check for any swellings. Doing the tenderness, checking the tenderness, you would go on to the lateral aspect. So in the groin, obviously, when you're doing the tenderness, when you're pressing, you're checking for any pains. Like for example, if they've got pains in symphysis pubis, they might be tender there. Pubic rami fractures and things will be tender in the middle. Lateral aspects, for example, pressing over the greater trochanter. Things like trochanteric bursitis will give you pains in that area. Similarly, you press down below, we'll do it in the middle, but we'll do the medial aspect. So you press along the medial end of the thigh for any adductor tenderness or any other medial aspect problems in the thigh. Now, after doing that, can you lie on the back, please? Now, what you'd be doing, obviously, you'll be checking for any tender spots in the back area. So you would check for if like sciatic pain or sciatic nerve pain would be tender in the middle of the bum. Then ischial tuberosity down below, you would press in that area if they've got any tenderness in that area. Similarly, pressing on the muscles, for example, gluteus, the hamstring muscles, if they're tender in that area, if they've got any injury there. Can you lie back on your back, please? Right. So after doing that, then the initial bit would be the active movements. So I would ask him for a few movements. So that we don't have a full space, so we'll try to assume that it's a proper couch and doing the full movements. So can you flex your hips for me? So bend it towards you. Yeah. So bring it more towards you with your chest. Right. So you're checking for flexion. Now straighten again. There you go. Can you spread your legs apart? So obviously if it's a full leg, then you check for any abduction. Now bring it together and cross your legs. Good. Now cross the other side. Good. So you're checking the adduction and abduction. You identify the extension we'll do on the back. So internal rotation would be bend your knee for me. Good. And move it towards this side. Good. And then move outside. Good. So internal and external rotation. So that would be internal rotation and this would be external rotation. Yep. Straighten again. Now lie on your back, on your front again. So lie on your sides, left and side facing outside. Okay. Now you're checking for extension So extend your, and for me that's it. So you check for any extension in that area as well. So we did initially flexion, extension, abduction, in the adduction, internal and external rotation. After that, then passive movement, you could do the same active movement. So if there is any movement, so I would be doing the same movements. So you're doing an extension, just relax, rotation movements, flexion, and adduction and abduction movements. Obviously, you can change the position and do it properly. We do the resisted movements. So first of all, can you pull it towards yourself? Doing that movement, I'm checking for the hamstring muscles. Any problem with the hamstring, that will either reduce movements or painful. Now straighten your leg and push against my arm. So that you're checking for the gluteus muscles. Any problem with the gluteus muscle will show obviously the reduced movements or painful. Lie on your back, please. Similarly, the flexion. So bring your leg up. Good. So iliopsoas muscle. Now bend your knee for me. Put it towards yourself and straighten your leg again. Straighten. Okay. Bend your knee and try to straighten again. Good. So that's you checking for the quadricep muscle, right? And push against me outside. Straighten your knee first. Straighten side. And push against me. Good. So that you're checking for the adductors. Bring your knees together. Good. So the abductors.